We are monitoring the measles in Michigan after the first case in Kent County in more than a decade.
We have a map that shows where cases are popping up across the country. Nationwide, there are more than 500 cases this year, making it the third most active year for measles since 2000. And that's the year the U.S. officially eliminated it.
A patient in Kent County tested positive this week. Here's the list of places they traveled across the state, from restaurants to airports. Now, if you're vaccinated, doctors say you should be fine. But we asked the infectious disease specialist at Trinity Health what else we should know now that this virus is here. What was your reaction to hearing that this disease has made it here?
Yeah, I think my first thought was it was a matter of time. Measles is really kind of frustrating because you typically have more vague symptoms for, 24 to 48 hours before the rash shows up. So, you don't know if you're just having a cold, but that rash comes on about 48 hours after the onset of fever and the other symptoms. And that's kind of like our starting point. So when you see fever and you see like runny nose and you see like eye redness and you get this rash that starts, that's really the time when you need to say, I need to reach out to my primary care doctor.
How are our numbers vaccination rate-wise in Michigan compared to Texas?
Our vaccination rates are over 90%. They are decent still, but we have small pockets that are hyper susceptible. So we have small pockets of communities that have made choices not to vaccinate for measles for a variety of reasons, and those populations are hyper susceptible. But at public health level, it's very straightforward. It's slam dunk. Like it's an amazing tool to eradicate an extremely dangerous disease. But at a patient level, everything we do, whether it's a vitamin, whether it's a probiotic, whether it's a vaccine, has individual risk associated with it. For example, like there is a small risk of febrile seizures related to this vaccine, where the fever can happen because of the vaccine and you can have a seizure from it. It's not a high risk, but it's real. And so being able to have an honest conversation about what that looks like, what that risk is, and then what do you do about it is huge.
Well, thank you so much for taking the time to talk to us about this today, Dr. Jamison.
Yeah, thank you for covering it.
So there is a difference, too, between the measles vaccine and like COVID or the flu. COVID and flu shot, those are pretty effective at preventing the most serious form of the illness that causes hospitalization. But the measles vaccine is 95% effective at just stopping it altogether. So it's very effective, and that's one point they wanted to make.
In 2000, they pretty much got rid of measles.
Yeah, they declared it eradicated.
Yeah.
So he's disappointed that we're here, but they're trying to make progress now.